So I want to talk today about giving insulin via an insulin pen compared to giving it through a needle, right? So remember, we have our insulin needles, and whenever we're giving insulin, we absolutely must use an insulin needle. And so you can see this package. I know it's backwards here, but you can see here that it says insulin on it. It says U100, and it's orange in color. And I'm not saying that they're all orange in color, but a lot of times that is an indication that this is an insulin needle and syringe compared to just a regular subcutaneous needle. So. And so with this one that I have here, this is a 28 gauge and 1/2 inch needle. So one of the main differences between giving insulin via a syringe and needle versus a pen is that with the syringe and needle, remember when we give the insulin or a subcutaneous injection, we usually have to angle it, remember that 45 to 90 degrees, and we're going to kind of do a jabbing motion into the patient's skin to get it in, right? And we want to make sure it stays in the subcutaneous layer. It's different with an insulin pen because we don't have to jab it into the patient, and we actually do not do a 45-degree angle. We do a 90-degree angle every time. So I want to demonstrate that and talk about some of the mistakes that I see students make when it comes to insulin pens. So insulin pen, of course, you're going to do your checks, make sure it's the right medication, do your 7 rights, and all that stuff. And you would be wearing gloves. I'm not wearing gloves just so the video is not too busy. So with this is you're going to have your insulin pen and you're going to have a needle, right? And we are going to be using one-time use needles. Be aware, though, if you're working in home care or maybe some long-term care settings, they may have, these particular needles have a safety device mechanism that I'm going to show you. Not all of them do, so just be aware of that so that you don't accidentally poke yourself, right, after poking a patient. But these ones have a really cool safety mechanism that I'll show you. Another thing with insulin pens is make sure that you're only using an insulin pen on a single patient, right? There's many doses in here, but you can't use this pen for patient A and then patient B also has insulin and I can't find their pen, so I'm just going to grab patient A's pen. Absolutely not. So there have been some issues throughout the United States. I think there was one at a VA hospital or a VA, I don't know, long-term care or something like that, where there was insulin pens being shared between patients by the nursing staff. And they found out about it because I believe like a bunch of the patients ended up getting like hepatitis or something. And so they backtracked it and found that the staff was using the same pens on multiple patients. And the thought behind that is that when we give this injection, there may be a little bit of blood that comes back up into the insulin. So then if I use this pen now on another person, now I am mixing blood between 2 patients. So, and this actually was an issue at the hospital before I left as well, because pharmacy sent out an email and a warning saying that these pens are not interchangeable between patients, so do not do that. So, all right, moving on. So the insulin pen, so you have a pen and you have your needle, and you're gonna have an alcohol wipe. And again, remember, you would have gloves on as well. So the first thing we're going to do is we're going to take off the cap, and you can see here we've got our dosing here. You can see how much insulin is in here. They're usually 300 units, but not always. And then you can see this is the end where the needle is going to go, right? So the first thing I need to do is I'm going to scrub this hub for about 15 seconds, just like we do with IVs. And we're going to pretend this is 15 seconds. Right, and then we should let that dry. You don't want to put it down on the table or anything because then it's going to be contaminated. But now we're going to add our needle on. So with these, again, these are a one-time use needle, and this is a 30 gauge and it's a 3/16. So it is a very, very fine small needle. So you're going to peel off the top here, and see if you can kind of see. I'm not sure if you can, but you can see there is a needle in here as well. And what's going to happen is this needle is going to poke into this piece here on the insulin pen because there's kind of like a little rubber piece, and that's how the medication will get out, right? So I'm going to take this and I'm going to put it together, push in, and then I'm going to twist it on until it's tight, right? Okay, so there you go. Now, normally I leave this cap on until I'm ready to give the insulin, but because I want to show you some of the pieces, I'm going to take it off. So I always just leave it on because the longer this is covered up, the less chance of an accidental poke or contamination. So, but I am going to take it off. So I'd like you to see here is that we have this clear plastic piece right here. And I know you can't really see on the video, but inside here is the needle, right? And so this piece is a safety shield that is going to retract back up once I come in contact with the skin. And so it's going to retract up, and then the needle goes into the patient, and then we administer the dose, okay? So keep that in mind. So the first thing we want to do here is we need to prime this needle with some insulin, because if I'm going to give, like, say 1 unit or even 2 units, if I just dial in my 2 units and then give it, there's a really good chance that patient's not going to receive that entire dose because there was nothing in the needle to start with, and so some of that dose is going to be left in the needle. So what we want to do, and this is going to depend on policy, but this would be best practice, is we're going to dial in to 2, right? And then I'm going to depress the plunger, and I'm going to essentially fill up the needle with insulin, right? So I'm going to squeeze it. All right, and again, you can't really see, but there's a little drop of insulin here. So now I know that the needle has been primed, and so then whatever dose I dial in for the patient, they're going to receive that full dose and not have some lingering in the needle. All right, so now we're going to dial in. So we're just going to dial in, we're going to just say 3 units. And so here's one of those things I want to show you. So remember, this is a retractable, and you're not normally ever going to stick your finger here, but I want to show you. Right? So you can see here, this is retractable, right? And the needle is right there. Okay. So what we're going to do is we're going to clean our patient's skin, right? And we're going to be using this thing as a patient. Hopefully you should be able to see because it's clear. I'm not sure if you will. But with these, so what I see students do is they go like this, right? And they put it in, right? And it goes in, and then they have to kind of like readjust their hand to get their thumb up to the plunger. And when they do that, remember, so the needle's in, but as soon as I lose contact with the skin, there's going to be another safety shield that automatically deploys to cover that needle again so I don't accidentally poke myself as a nurse. And so what I see is when students are trying to like maneuver their hand up, they lose that contact, they get up here, they press the button, and the needle is no longer in the patient because that new safety shield has activated, and they just squirt the insulin all over the patient's skin. I've seen that happen where it's like dripping down their arm. So that's why I kind of want to show you these steps here. So what we're going to do, again, remember, we're not jabbing it in, but we're going to just push it, we're going to push it flat against the skin, and then we're going to push it in, and the click that we hear is going to be this first safety shield retracting and the needle going into the patient. All right, so I'm going to stop talking here, and again, we're going to go in at 90 degrees. So, and again, I don't want my thumb on the plunger, I just want it ready to go onto the plunger, because if I have it at the same time, I might squirt it in too early, the plunger, and again, not get it in. So, okay, listen for the click. Okay, so now the safety shield's up. I don't know if you can see this without me moving, you probably can't, right? But the needle is in, and now I'm going to depress the plunger, and I did 3, right? So I should hear 3 clicks. Well, I heard 2, but I had 3, right? And so now the insulin's in, and you want to hold it in place for about 10 seconds. Now, what is going to happen as soon as I release from the patient's skin, that second safety shield is going to activate and go into place. So let's see if I can show it here on the video. Ready? 1, 2, 3. Okay, so now you can see we have a new safety, and this one does not, when I push down on it, it does not go down, right? Because it is covering up that needle, because now this needle has been in another person. I don't want to accidentally poke myself, right? So that's why this safety shield does not even push down if I were to try, and I don't want to. So yeah, so that's it. Now this is a one-time use needle, right? I can't use this again because this safety shield is up. So I'm really just going to undo it. I'm going to put it in my sharps container, and I'm going to put my cap back on. All right. So again, the big difference is that we're not going to jab. We're going to go in at a 90 degrees. You need to hear the first click, which means the safety shield has gone up. The second, and then we're going to administer, hold it in place for 10 seconds. And then when we lift off, that second click that we're hearing is going to be that permanent safety shield that goes into place to help us prevent from poking ourselves with the needle.